Hello, my name is Mona Dispani, and I'll be doing a checkoff on inserting an indwelling catheter and also doing catheter care. First of all, I'm going to introduce myself. My name is Mona Dispani. I'm also going to identify my patient, whether it be asking them their name and their date of birth or scanning their arm name. And next, I'm going to explain everything to my patient, what I'm going to be doing, as well as checking my physician's orders and matching it to the MORS to making sure that everything is pertaining to what I'll be doing today, which would be inserting an indwelling catheter and also doing catheter care of the male patient. First of all, I'm going to wash my hands thoroughly. Then I'm going to make sure, prior to that, I'm going to make sure that my patient is comfortable. I'm going to put them in a position where that they can be comfortable. The female would be in recumbent, or the male would be in supine or fathers. But I'm doing a male today, so he's in supine position. Then I'm going to wash my hands, and I'm going to apply some gloves because I'm going to do um, perineal care first. I'm going to wash the area clean, apply some gloves, and I'm going to wash the male area clean first. This is soap, antibacterial soap, a little water. I'm going to pour it on here, and then I'm going to hold the shaft of the penis. I'm going to wash in circular motion the shaft around the head of the shaft from the inner to outer. Dispose of my rag. Then I'm going to come to the other side from the inner to outer of the shaft of the penis, inner to outer. Just throw it in the trash, and then I'm going to come right in the center of the opening of the meatus and the shaft of the penis, and I'm going to dispose. And now I'm going to remove my gloves. I'm going to discard of them into the trash. And then I'm going to go wash my hands again because now I'm going to do insert the indwelling catheter. I've already checked my orders to make sure that everything that I need is on the MARS, which is the catheter. All my supplies are here. And my patient, I'm making sure that he's comfortable. He's in supine position. And I have all my supplies here in the area. Again, I'm going to introduce myself. My name is Mona Dispani. I'm going to identify my patient, whether it be asking them their name, date of birth, scanning their ID. I'm going to make them comfortable, put him in supine position, and I'm going to get ready to open my supplies. I'm going to make sure that I maintain sterile field, make sure all my supplies is within the sterile field area without contaminating it. Leave it at least a 1-inch border. This is just the padding that I have laid out. So now I'm going to begin by opening up my package from away from me first without contaminating. Touching the outer part, touching the outer part of the cloth, and the last part is opening it towards me, making sure I'm not putting my hand over the sterile field. Now I need to make sure that I have enough area where I can get this out of the way. So it's not in my area. Now I'm gonna get the covering so I can lay this across the male's penis, laying the little pad. Make sure that I not contaminate the. Sure that I apply this across. Not to touch anything. And then I'm gonna get this other padding. This would be for the female, but I'm gonna just lay it here. And next I'm gonna get my gloves. And I'm gonna lay it, sit it here. I'm not gonna put it in the sterile field. I have it right out here. It's not over here. I'm gonna open it without touching it. 3-inch, 1-inch from the package. That out. Discard of that. I'm gonna lay this away from my sterile field as much as possible. upside down. Make sure I pinch it. I'm going to put on my dominant hand first by catching it from cupping it with my hand, fingers out, not touching the sterile part. And I'm going to keep my hand above my waist. I'm going to do the same thing with my non-dominant hand. Now, my hands are sterile. Move this out of the way. Touch it with my elbow. Make sure I don't touch anything. Hands are sterile, so now I can touch all my supplies that I need to get my catheter connected together. First, I'm going to grab my syringe and I'm going to connect it. Try to keep my sterile hand. They both sterile right now. Everything is sterile. Connect. Take my cap off. My hand's still sterile. This is still sterile. So I'm going to take this off. Throw it in the box. And connect the syringe to. I'm still in my sterile field. So I can lay this down for just a second. Lay this down. Now I have my swabs. And I have my gel. I can open that. My hands are still sterile. Both hands still sterile for the moment until I touch the opening my gel. I'm going to put my gel in here. Gel out. Hands still sterile. And my swabs. Clean the shaft of the penis. And I have everything in place to get ready to insert the indwelling catheter. First, I'm going to clean with one swab. Now, I'm fixing to touch this. No, can't touch it just yet because I have to, but this is still sterile. Everything is still sterile right here. Still sterile hand. So I can take this off. Still sterile hand. Still sterile hand. Now, I'm going to grab. Still sterile. Now I'm fixing to grab the penis so I won't be able to touch anything anymore. Now I'm going to clean. First swab. I'm going to go from inner to outer. From the inner to outer of the shaft of the meatus and the shaft of the penis. Discard. Do it again. From inner to outer. Shaft of the penis. Discard. And the last one, I'm going to go right to the center of the penis and the orifice in the opening, and it's outer, and discard. Now I'm going to get my catheter. Hand is still sterile. Still in the sterile field. Still in the sterile field. Still in the sterile field. Now I'm gonna gel my catheter, gel it all the way to the end, all around the catheter of the tubing, and then now I'm gonna insert. I'm gonna tell the patient to relax and take some deep breath as I insert the catheter into his penile area. Deep breaths, relax. I'm gonna go in circular motion. Relax, relax, relax. As I insert it, still continue to relax, relax, relax. I'm gonna go all the way to the tip to make sure. And if you can see like the opening of the 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 cup the padding, you can see the catheter is all the way on the other side and up until his bladder, all the way to the end. Now my hand is still sterile. I'm gonna get my syringe and I'm gonna inflate. I'm gonna inflate. I'm gonna inflate, inflate, inflate till all of the fluid is in the balloon. And then once I inflate all of the fluid into the balloon, now I can disconnect and make sure that I tug on the catheter to make sure that it's in place. And it is in place. And now I can release my hand and I can take the catheter out. Hands, non-dominant hand, this is still sterile. I can take my catheter out and make sure that I tape the catheter to the male's abdominal area or the stomach. Catheter is still in place. Make sure that the catheter is hanging at the side of the bed. Make sure that the urine is draining, clear urine on the side, either on the bedside rail where it can be drained lower, it can be drained, urine can drain down, and that the patient is comfortable. I'm going to sit it right here, away from the sterile field, because if I let it go down here, the tubing is going to fall out. So I'm going to just rest it here, away from my sterile field, and I'm going to remove all of the supplies, discard it into the trash, and make sure that my patient is comfortable. My hand is now, since I'm no longer in the sterile field, everything is done. I can remove this off of my patient, take all of that off. I can remove my gloves and make sure that everything is off of the table. Everything is removed off the table. It's no longer a sterile field. So I'm moving it to the side, making sure that you can see that the catheter is in place. The balloon has been inflated. The catheter is taped securely. Let me get tape. Hand using a non-dominant. This is not a sterile tape. It would be taped to the side of the male's abdominal area. I'm just going to tape it right here just to demonstrate. It would be taped to the abdominal area right here. It was kind of obvious, but this is where it would be taped up at, right here. Right here. I don't want to drop the catheter on the floor, I don't want to contaminate it. Sit it right here. And as everything is away from the sterile field, the patient is made comfortable. I can remove my gloves. I'm removing my gloves. I'm making sure that I'm removing it properly. discarding it into the trash. I'm going to wash my hands thoroughly, and I'm going to document the procedure, how the patient tolerated the procedure, if there was in the color of the urine, what color the urine was, if there was any consistency, if there was any sediments or anything in the catheter. Made sure that my patient is comfortable. Made up the side of the bed rails, call bell within reach. Thank you. This is the end of inserting an indwelling catheter in the male and catheter care. Thank you.